Hello everybody, my name is Dr.M Niharika. I'm working as a fertility consultant in Kamineni Fertility Center, Koti branch. Today I will be speaking about the topic sperm fragmentation, or in more precise way sperm DNA fragmentation and its effect on fertility. So we do see that many patients or many couples have normal parameters or normal fertility parameters, but still they are not able to conceive. In those patients, we have to be more cautious about the problem called as sperm DNA fragmentation. Now, sperm is a very small and microscopic structure. So, it like other organisms has got different body parts, and the nucleus or the DNA composition of the sperm is a very compact structure, and it is in a condensed form to the extent that it is decreased or condensed to less than 10% of the volume. So in this condensation, their DNA structure undergoes different changes and forms different loops called as toroid loops. So these loops are very tight, and usually they are not prone to any damage from the external structure, but sometimes if they are exposed to the prolonged causative factors, there might be a damage in this DNA. And as we know that the embryo takes 50% of the contribution from the sperm DNA. If there is a defective DNA, then obviously the embryo also can be defective, or it can lead to infertility. So male factor contributes to about 30 to 40% of the cases of infertility these days. So we cannot neglect even minor changes or the minor abnormalities that we see in the semen parameters. So the basic test that we do for a semen parameter analysis is the semen analysis, where we check three major parameters, that is the count, motility, progressive motility to be more precise, and the morphology, or the number of the percentage of the sperms that are in the normal shape. Because if the sperm is in the normal shape, we assume, or most probably the normal shape sperm is having good DNA integrity, is what we assume most of the times. And that's why we at least want to basically understand whether the morphology is in the normal range or not. So 4% is what we consider as the normal range of the morphology. If a semen parameter is having normal count and motility, but is having defective morphology, that is morphology less than 4%, then we categorize it as teratozoospermia, and this diagnosis can lead to the subfertility or the infertility in that couple. Or sometimes these index for teratozoospermia can also lead to what is called as decreased pregnancy rates or live birth rates, and increased risk of miscarriage, because such an embryo that is formed from the abnormal or the DNA fragmented sperm can lead to the increased abnormal formation of the embryo and increase the chances of miscarriage, or the sudden loss of cardiac activity in such an embryo. And that's why there arises the importance of identifying whether the DNA fragmentation is there in a particular semen sample or not, especially in those patients who are having teratozoospermia and also suffering from subfertility or the unexplained infertility, where the other parameters like the ovarian reserve, the tubal factor is perfectly normal, still they are not able to conceive. And many studies or research has shown that there is 51% chances of the DNA fragmentation turning out to be positive in cases of infertile samples, compared to the 30% only in patients who have undergone or who have conceived on their own. So now we can understand what is the importance of this DNA fragmentation. Now we'll understand how does this DNA fragmentation happen, and how to test the DNA fragmentation. So as I have previously explained, the DNA structure, where we see it is in the normal cells, we see that the DNA is in a helical structure, but especially in the sperm nucleus, the DNA structure is different, because it is condensed to such a great volume that large amount of DNA is condensed into a very small structure of the sperm head. So in that sometimes condensation, it is abnormally forming. There are two main proteins in this condensation helping the condensation of the DNA of the sperm, that is histones and the protamine. So during the maturation or the different stages of development of the sperm, the protein compositions of these two proteins differ. So, if it is an immature sperm, testicular sperm, or the sperm still not undergone complete spermiation or the maturation, it is that the early stages of the spermatids, there is more amount of histamines and less amount of protamines. But this, over a period of time when the sperm is undergoing maturation, converts into more amount of protamine and the less amount of histones, to the extent that 85% of the composition of the nuclear proteins is of the protamines, and the rest is formed by histamines. And this protamine structure or the protein is the one that helps in the condensation, and it protects the sperm DNA to get damaged while it is having a lot of journey through the genital tract, because the sperm, as we know, has to travel from the vagina through the cervical osses, internal and the external, into the uterine cavity, and from there into that of the fallopian tube, and then it has to get fertilized. It has to fertilize the egg. So in this journey, it can get damaged at any point while traveling through the cervix or to the uterus and then the fallopian tube. So it has to be protected, and thus this condensation of the sperm DNA helps it to be protected from the other external factors that can damage the DNA. And the other, normally, even in the spermatogenesis, normal production of the sperms, we see that we know that there are 4% normal, 4% and above normal percentage of the normal sperms seen, and that is considered to be the normal fertility sperm parameter. This happens normally because of the natural apoptosis, or what is called as natural cell death of the abnormal sperms that are being produced. So that is why we see normal. But if there is an abnormality in this apoptosis process, where there is abortive apoptosis, that meaning that the apoptosis, that is the cell death of the abnormal cells, is not happening anymore, and there is the presence of abnormal sperms when they ejaculate to the stage where the ejaculation sperms we see. So that is why we see more of the abnormal sperms, because they are not being undergoing cell death. This is one reason. And also, abnormal condensation or the protamination leads to the damages in the DNA, and that is why we see DNA fragmentation in the sperms. So it is also proven with a number of studies that whenever a patient is undergoing IVF or ICSI process, there is decreased fertilization rates, decreased chances of the embryo crossing the cleavage to that of the blastocyst stage, decreased formation of the blastocyst, decreased embryo quality, and also decreased implantation rates, and hence the decreased pregnancy rates in patients who are having the abnormal or abnormally high DNA fragmentation in their semen parameters. So the abnormal DNA fragmentation can be seen even in the normal semen analysis parameters. So we don't have to wait for the abnormality to be detected on the analysis and then go for a DFI. Wherever we feel that the subfertility or the infertility is due to the would probably be because of the DNA fragmentation, we obviously have to suggest the higher test of the DNA fragmentation index. So there are particular tests like tunnel assay, sperm chromatin structure assay, or the sperm chromatin dispersion test. These few tests help us to analyze what is the DNA fragmentation index. So this fragmentation index helps us to categorize the semen parameters and then customize the treatment in that particular patient, because in a patient who is having the higher DNA fragmentation index, the normal cutoff is about 12 to 15. So a DFI less than 15, meaning that if the index is less than 15, it is considered to be the normal sperm parameter, because less than 15% of the sperms are having abnormal index, which is considered to be normal. But if the DFI is raised more than 15 or severely high as 20, 25, 30, such semen parameters have to be first given treatment to decrease the DNA fragmentation index, and then only even the ICSI can help in those patients, because highly fragmented DNA sperms, if they are used even for ICSI, the fertilization rates are decreased, embryo quality is decreased, and the implantation rates are decreased. So doing a DNA fragmentation index helps us to analyze and categorize the treatment protocol, particularly for that patient. Thank you.